typically speaking, a lot of those people have driving glasses to drive at night because the nearsighted eye has all kinds of glares and halos around lights at night. And so they're not happy with their driving with monovision, so they have a driving pair of glasses to drive at night. But they're still happy. They wanted monovision, they wore contacts that way, and there's no problem doing it that way. The advantage of the bifocal implant is both eyes are clear at distance and both eyes are clear up close, so you don't have a depth perception problem. Yeah.
You mentioned doing 3 of this type procedure today. Are you still doing the old-fashioned way with the phaco?
Well, it's still phaco. All of them got phaco. It's just the laser can do the incisions, the capsulorhexis, and soften your lens. But we still have to go in the eye and emulsify the lens and take it out. So the laser's advantage is less ultrasound time while we're doing the procedure to get the lens out, and consistency in how round the capsulorhexis is. And those are the winning points of the laser. And I can't tell you how big a win it is because this is still early on. But I can tell you it's really nice. The one lady who had a hypermature white cataract, that capsule is clear cellophane. So when this happens a white cataract, it's almost impossible. We put a dye in the eye to stain the capsule. But they're called ripe because or overripe, like a apple that starts getting ripe and it starts melting, the capsule becomes very fragile, and that's the reason why that surgery is a little more difficult. But that laser did it perfect.
What is the price difference between?
Every doctor in town is going to have a different price difference. The ones who are going to be doing it, because not everybody's going to be doing it, because there's only 2 lasers in Southwest Florida. Probably the next closest to us will be Sarasota or Bradenton. So the doctors who are going to be doing it, it could be anywhere from $1,200 to $1,800 extra for the procedure. I don't know for sure because I haven't called everyone to see what they're pricing, but we're charging $1,500. Sort of somewhere that I think is in the middle. And to be honest about it, most of it, I'm not sure. I mean, this is extra, another step, an extra procedure. It's really nice for you because you get perfect capsulorhexis and all that. But $850 of it goes to the laser company.
And then you pay for the lens.
And so it depends on what kind of lens you want.
Yeah.
So a regular lens covered by Medicare. The fancy lenses depends on what lens you got, on what the prices are. So we have a whole laundry list.
Oh, really?
I mean, before you used to come in having cataract surgery and okay, we're going to do it and that's it. It's now, Ronnie probably spends an hour with a patient discussing everything, going over everything. I go over the lenses, she goes over the lenses. We give this all written. We have the brochures today if you want to get that. And so it gives you all what the different lenses do and all that kind of stuff. And so it's a process anymore. I mean, this is not like, it's just not cataract surgery. It's what kind of vision do you want when you're done. So it's different, and it's more time consuming. Yep.
How much time interval between doing each one?
A week or 2. Yeah.
What about floaters?
Floaters floaters happen because the jelly in the back of your eye that's attached to your retina through sometimes with just over time and age or injuries or different things, that jelly can move or liquefy and it pulls loose from your retina. So now you see that attachment floating around in the jelly inside your eye. And 98 to 99 times out of 100 when people get floaters, nothing happens. You have floaters, a lot of times they get better, sometimes they go away. But occasionally it tears your retina when it pulls loose, and then you potentially have a problem of retinal detachment. So when you get floaters, you need to be seen pretty early on when it first happens, so you make sure your retina is okay. As long as your retina is okay, you're good. Yep.
I think you said early on that if you don't like your lens, you could have them changed out. Is that true?
No.
Or is it a one-way deal?
It's a one-time deal. I mean,
you can never have it done.
you can, but the surgery to take out your old lens and put one of these new lenses in is more intense, more complications than the surgery the first time around. And unless there was a problem with the lens in some way, which isn't very common, then you would not want to touch that lens unless you had to.
Is that why all these measurements are so essential for placing the proper size lens?
The lenses are pretty common, the same size as the strength of the lens. Or in, say, astigmatism, is how strong of astigmatism lens are we going to put in the eye. So all those measurements are critical in getting you the best result. And so there's a lot of stuff that we go through. Yeah.
When I was in your office the other day, you said that maybe you could tweak the astigmatism
Yes.
of the lens so that I could still see up close with my naked eye.
No, you're not going to tweak the astigmatism. We can make one eye more nearsighted than the other. So you can choose, once the machine measures your eye, then I can choose the lens that makes you good at distance, or I can choose a lens that gives you a little better reading, but not so bad at distance.
But
Or
it
if
still
you-
wouldn't be mono.
Right. Well, it's semi-mono. It's sort of a modified mono. Or I can give you really good reading, but then when you give you really good reading, that distance is going to be bad.
You made the comment that some physicians are more adept in doing this procedure than others. How would one know?
You don't.
Okay.
You don't have a clue. I know because I see things, but you don't. That's the one. You have no idea. And who's on TV and not on TV makes no difference. And you don't know. So the only way you know is the nurse here. She keeps track of who's good and who's not good in town. She hears the stories and the bad stuff and the good stuff. And so you know that, or if you know someone in the field, then you can get an opinion. You can ask your own personal doctor, who would they go see? That helps a little, not a guarantee, but it helps a little. And so there's no easy answer to tell you how to pick a doctor.
Our daughter is a third-year resident in ophthalmology at The Ohio State University, and she said that a lot of times ophthalmologists have to correct what some optometrists have done.
Right, and that happens too, but except now in Kentucky, they passed a law where they can do some surgery, and in Oklahoma, optometrists can do surgery in some of those two states. Just because the legislature, they bought enough people off that they got it passed. They don't have, they're going to take a weekend course to learn how to do cataract surgery, and then they're going to start doing it. It's crazy, but that's the government for us. Yeah.
What can go wrong during procedure?
All kinds of things. So, with the you want, well, go just with the cataract surgery, generally speaking. You could get an infection, you could get a hemorrhage, the retina can swell after the surgery, the cornea could swell, you could have mechanical problems, the capsule could be torn, you couldn't put the implant in, you could get severe inflammation in your eye, there could be all kinds of things. The good thing is that cataract surgery is probably the most successful operation, if you have to have one, to choose to have. 97% or so of people who have cataract surgery have no problems. The 2 or 3 or 4% of people who do have problems are those kind of things. The swelling in the retina can be treated and go away. The cornea can be fixed if it really was that bad. A lot of times it will get better as it heals. Infections are very rare, maybe 1 in 4,000 or 5,000 cases. I mean, it's pretty rare. So the complication rate is very small. As far as the laser goes, probably you do get, because that attaches to your eye, you get tiny little micro hemorrhages on the white part of your eye, but they go away in a few days. I mean, but that is a complication. Nothing that bothers you, but it's visual. We could lose suction. That sucks to the eye, so you could flinch, move, or something happen, you could lose suction, and it wouldn't do any bad thing to you, just mean we're probably not going to continue with the laser part of it and just do it the regular way. And theoretically, in the beginning, when they were first learning with the laser, they were getting too aggressive in that back chopping of the fragmenting of the lens. Sometimes it was breaking the capsule posteriorly, so they finally have moved that further up, and that hasn't been a problem. But those are the kind of things that can happen. In residency, that capsulorhexis, that tearing in that little cellophane, is pretty delicate. And 20 to 25% of residents mess it up. It's just because there's a learning curve. I mean, that's just the way it is. And so a lot of, you practice on rabbit eyes, and you do what you can do, all these things to get good at it. But those are the complications. Fortunately, it's just, most people just do really well, as long as, the biggest problems I have is people who come into me, is they say, I don't see any better after the surgery than I saw before the surgery. Now, most of the time, I haven't seen these people before, but they really have a pretty reasonably good result. Probably they just didn't have a cataract to begin with, so then it's hard to notice the difference. So like I said, you have to be very careful that you really have a cataract there, and there really is something there, because the unhappy people I have, I think, they're not that they've had such this horrible result. I mean, there are complications. It's not that. It's usually, they look pretty reasonable, they're just not happy. And they're not happy because they probably didn't see a difference because there wasn't a cataract to begin with.
A couple of people that friends that have had it in both eyes, always their comment was, the first surgery was wonderful. The second surgery didn't go as well.
But then that's not uncommon. And the reason is the first time around you're so scared that something's going to go wrong and all that you're expecting this horrible procedure. Well, that wasn't bad. And then you come back the second time, well, there was a little, someone really did something to my eye. And it's pretty common, and we hear it, I mean, it's just sort of funny, we're in the operating room. They come into the second eye, and we're starting to do this, I'm awake more this time than last time. All the time they say that. And we keep saying, no, you got exactly the same milligrams of Versed as you got the first time. The thing is, it gives people amnesia. So these drugs that they give you to calm you down give you amnesia. So you won't remember you told that to us in most cases. But they always say, oh, this is different than the first time.
So should you have somebody drive you?
Yes, because you can't drive. The surgery center is going to say you can't drive for 24 hours. So you can't drive that day because they've given you mind-altering drugs, and so they don't want you to drive. So you have to have someone come with you. Typically speaking, the time you walk in the door and walk out the door is about 2 hours.
Where do you do yours?
We have a surgery center in Fort Myers that is actually just about 1.5 years old. It is, well, almost 2 years old. So that is the state-of-the-art, probably one of the finest surgery centers in the world, actually. Top 5, maybe? I mean, it is. Well, we have we got every piece of equipment you could ever imagine.
Where in Fort Myers?
It's on US 41, just north of College Parkway, on the right-hand side. So one other thing I do for the church is when we do these, I don't do it for other folks when we give seminars, but for anyone who's not a patient and they want to know what the status of their eye is, we give you a free visit. So you can come in and I'll tell you what really is there and let you know where the status is, and you can get that free consult. We also have a bunch of the brochures that give you all the different things we do about precision cataract surgery and all the different kind of lenses we got. And so you have that information as well. And so, and we're going to be actually giving another talk in March. And so in March, it's going to be on dry eyes. People can ask about cataracts as well, but it's going to be on dry eyes. Dry eyes is probably the most common problem I see in my office. And it costs the U.S. laborers, figured out it's about a $5 billion loss a year in productivity in the workforce because of people having problems with dry eyes. And the amount of people spending money on dry eye drops and treatment is billions of dollars. And so we are one of the few places in the world that you can actually have your tear film analyzed. So we can actually analyze what's wrong with your tear film, not just say, here's your teardrop and see you later, but we can actually analyze what's wrong with the layer of your tear film, how salty and what the osmolarity of your tear film is, and actually specifically treat what the underlying cause of your dry eye is, not just here's a drop. And so we'll go over all that and give you the data behind it. And I mean, this laser and this new treatment and things we have has all happened in the last 6 or 8 months. It's But it's pretty interesting that how crazy things have changed, but, I mean, we see, I have a lady who flew from Seattle to get her eyes treated for her eyes. And I had another lady who flew from Colombia, or where's she from?
Yeah.
South America,
Yeah.
some, to get her dry treated because there's only 50